Good morning. So we had a very informative talk from my senior colleague Dr. Rajan and Dr. Dinesh. In the morning when I woke up today, it was very nice drizzle. And it was a beautiful atmosphere to just cozy up and have a nice cup of tea or coffee, sit near the window and enjoy the weather. Well, what happens to our kids when they hear this sound and when they see thundering and raining so heavy? They just want to go out and get wet. They come rushing to us and say, "Mama, I want to go out. I want to get wet. I want to play." And we want to say, yes, please go ahead. But something holds us back. There is some fear within us. We want to send them out, but we feel, oh, what if they fall sick? And this is not only with the rains. Next. To eat, like ice creams, chocolates. Well, kids and chocolates, how can you say no? And we have so many food fads. You can't eat bananas, you can't eat fried food, you can't eat yogurt, you'll have cold. You can't have grapes, you can't have oranges. And the list is endless. If we have grandparents in the house, you have endless list. Well, all our kids go to nurseries and playgroups which are air-conditioned room. So one child has an infection and all the students get the infection from them. In today's life, the pollution we can't avoid. There is no escape from that. You step out and there is pollution. Artificial colors, artificial flavors. We are very aware parents. I would not expose my child to any of this. I'm very cautious. But still, kids fall sick because they have inherited this kind of tendency. Yeah. So, well, I'm not talking about the big diseases. It's simple colds and coughs. Most of the parents sitting here, we would say, my child is falling sick again and again. It's simple throat infection, simple viral fevers. They have something, they're out of one episode and in 2 weeks, 3 weeks, 4 weeks, maybe change of weather or whatever may be the cause, they are again down with something else. And they go to doctors, they take antibiotics, they suffer a lot. And next. And the suffering that we talk about, they lose their appetite. Anyway, it's the commonest complaint. 99.99 mothers would say, my child is not eating well. And when they fall sick, even my mother says this at this age. It's a maternal instinct. So, when they fall sick, they become very cranky, they don't want to eat anything, they lose their appetite. Most important is they develop a lot of fear of going to the doctors. And next, and no, you missed a slide. Yeah, parents pass through a lot of stress. I don't have to speak much about what parents pass through. All of you are parents here. And you would know the stress that happens to you when your child falls sick. Sleepless nights and so many things. Let's hear from this patient what happened to them. The child used to have bronchitis, was diagnosed with having bronchitis and would fall sick again and again. He would have to be nebulized 7-8 days continuously, twice a day. He was even hospitalized once or twice. And recurrent episodes of such events. Let's listen.
When he was small, he was born.
On and off, he always falls sick. Always cold, cough. A bit of climate change also is nice. He's up to my problems.
He senses.
No, there's no problem. I'm not over.
He will do normal.
Could the doctor give you a choice?
Okay. When he was born, after bath, he wanted fan. So we used to put that on his bed, or AC. Well, all of a sudden even thereafter his immune system we felt is getting weak. Every I think so change of climate also is affecting him very much. He likes fruits. The doctor's advice he should not have fruits when he's having cold and cough.
Every time he has cold.
And when he has any problem, he goes. We don't know when he takes it. He just picks up and eats.
Yeah, next. So when a child comes to us with such an acute episode, child is very breathless or coughing a lot or he has a severe pain, the first priority in our mind is to give relief to the symptoms. Parents are in so much panic and then we are not in a sane mind. We want to give relief to our child as early as possible. And it's a very wrong conception in people's mind that homeopathy is not good for acute attacks. So when you have your child with fever or some problems, you give something else, let the symptoms subside and then we go to homeopaths. Well, I won't speak more about it. My colleague, she would show you, Dr. Divya, she would show you more cases about how in homeopathy we tackle acute cases. But once you have taken care of the acute episodes, what do we do next? What about the next episode which is anticipated maybe 2 or 4 weeks down the line? So what we do, let's listen to the follow-up first and then we go ahead. What happens? Because that will give you a brief idea about it.
So, tell us about Aaron. How is it doing?
I was doing quite fine. What first he used to go through, like every 15 days he used to get a bronchitis attack. But now, like something about 1.5 months, 2 months, as the climate changes or something. Otherwise, it's quite fine.
But you still get this kind of bronchitis and this kind of headache.
No. First I had to put him for nebulizer twice, per day for something about 7 to 8 days. But from when this started giving homeopathic medicine. I think after 2 months or something, I got a very positive result. So nebulizer is off. He can eat whatever he wants. Otherwise, previously the doctors used to tell me not to give him banana, not to give him ice cream, not to give him anything, mostly fried thing, anything, whatever he used to like. But now he eats everything. Without us knowing.
Yeah. No? He drink cold water. No? Ice cream. But he enjoys ice cream. He eats that.
Very good, very good.
Earlier we used to don't eat. Now, come on.
So he's enjoying his life.
Yeah. Whenever we used to go to Goa, we had a fear because once or twice we had that he had that attack.
And then we had to shift him to the hospital. But now,
So, but his fall sickness, this attacks, this frequency, does he still get it?
it's reduced quite an extent. I think from last 3-4 months I didn't give him even the SOS also. So it's quite fine, active.
Very talkative. Since after medicine he has started becoming very talkative.
But meeting people and social interaction and everything is good.
That is fine.
That is okay. That's
That
fine.
is good.
उसका जो shyness बहुत था आप लोग पहले भी have observed that he used to be very shy. Is that still, do you see
He
this?
was in mixes.
Only over here.
Only here.
But now again if you see his movement, his action, you might be seeing that change also. He used to never sit like this. At least face to face. Yeah, it's big.
But do you feel his fears are less compared to earlier?
Yeah, it is reduced.
Yeah. Next. So how do we do it? The question that comes to our mind is, what do we do? How do we raise the immunity? Suppose if he's exposed to, let's say, cold wind or he gets wet in the rain, is it that only his respiratory system or tonsils or throat is affected? How does it get affected? He is exposed to cold wind and rain, that affects his nerves. Or he sees something very frightful. How does that affect his chest, his nose, his glands? Or he eats something like banana or ice cream. How does that affect his respiratory system? So it simply says that human being, we are not, our systems, they don't work individually. Dr. Rajan very well spoke about our concept of holism. We call it PNEIXS, that is psychology or the psycho, neuro, endocrinal and immunological system. It simply says that all the systems are connected together. In our homeopathic words, we call it a vital force or vitality. So when we take the symptoms of the patient, what we look at, not only the symptoms of cough and cold that bothers the patient, but we look at every aspect. My colleague already showed you what we do it. We ask about their mind symptoms, we observe them. What are their likings and dislikings in food, in weather, how is their growth, how is their developmental milestones. Not only restricted only to the child, but our colleagues spoke about it, that we go to the mother's history during pregnancy. Basically, we want to understand the constitution of the patient. So, next. So you can see that we would select some symptoms of the complaint, something about the food liking and something about mind, and next. And we would select a medicine. In this case, I gave an energy of zinc metal, which we many times take as a supplement, but here the energy of that substance is used, and the child did very well. What I want to emphasize here is the change that happens at a deeper level. It's not only that he feels well in his cough and cold, but how you saw in the child's case, that he could eat and drink everything. Well, fruits or chocolates or ice creams or going out, playing out in outside, all those things, they don't affect them so much. Emotionally, mentally, you see the change. For example, in the child, you could see that his fears were much, much better. So the change that happens at a very deeper level, you know, it's a common thing we say, homeopathy jad se ro ko nikal deta hai. So this is what we call it. So when the change happens at roots level, you see the immunity going up. This is how it works. I want to highlight, this is one more patient, a small video. It very beautifully highlights the smile of the patients, the parents, how they feel better, and the change that happens not only in the child, but in the family as a whole. Yeah, let's play.
How is he?
Adi is fine. In fact, after coming to Hong Kong, he's like quite good. Not only Hong Kong, even in Bombay he was doing well.
So, what was it earlier, before we started the homeopathic medicine? What were his complaints? Can you tell me?
Yeah, sure. Like when he was 2 months old, he always used to have cough and cold. And it was quite severe. So every time he used to go to doctor and get some bottles of syrups, antibiotics. So every month, almost every month he used to have medicines. And my medicine box was like full of antibiotic and medicine, and it was very regular. So it happened till when he was till 1 year, we were almost every once in 2 months we were giving him antibiotic and syrups, but he was not cured. So later on, I mean his health was also deteriorating, his growth was not good. So when we started homeopathy, and I found that he's really doing good after we started homeopathy. After starting homeopathy, I don't remember, once also we have given him antibiotic. So, and right now he's 3 years old, and it's been more than 6 months he has fallen sick. So this is first time in his lifetime, for 6 months continuously he has not fallen sick.
Pause.
And this is.
So, So what happens is when we give homeopathic medicines, the immunity of the child increases. So each episode they fight better. There is an infection, we give homeopathic medicines, we stimulate child's immunity to fight the infection. So the next episode which comes, the immunity fights much better. So the intensity and the frequency of the attacks go down over a period of time. And the pleasure which you see on the child and on the parent's face, that's so good to see. So next time when you hear this rain, when you hear thundering, don't hesitate. Let your child go out and enjoy his life. Let them eat or drink whatever they want to do, because we are assured we can take care of them. Thank you.